Soundlife is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. Our goal is to promote hearing healthcare as a part of healthy lifestyle, and our services include comprehensive hearing tests, hearing loss, tinnitus rehabilitation, and hearing aids related services such as prescription, fitting, tuning, servicing, and etc.
My name is Aliyah Shin. I'm founder and chief audiologist of Soundlife Hearing. I'm a believer of better hearing, better life. Living in a world of sound can definitely transform a person's lifestyle and personality.
In Soundlife, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. Soundlife Hearing was founded in 2016. All the operation, management, and clinical tasks are run by a team of passionate and qualified audiologists. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
We felt the most joy when we see the transformation of a patient's life. It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children, and so much better than last time that I can't.
Of course, Soundlife was the one that actually helped me to improve my hearing. My hearing impairment improved tremendously, and I'm very satisfied with that.
Our mission is to provide hearing healthcare as a part of healthy lifestyle, to raise hearing awareness of the public, to remove stigma of the society towards the hearing impaired, and most importantly, to empower people who suffer from hearing loss to live to the fullest with the latest hearing aids or cochlear implants.
Here at Soundlife Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Hi, my name is Lim. They call me Ron Lim. I have been a patient of Aliyah Cheng for about 4 to 5 years. And I find that she is one of the best audiologists among all the professionals around. Well, I was one of those who have been in denial, actually. I thought that I was not having any problem with my hearing, until I found that watching TV and having to rely on the subtitles became my regular affair. And I found that the more I watched, the more I had to rely on the subtitles. So I found that that could have been something wrong with my hearing. And I went over with my son, who brought me to a hearing aid center. And they found out that I was having problems with my hearing. But I wasn't very satisfied with whatever I saw those people there, because they were not very, they didn't take much care about trying to get into the problem, the heart of the problem. And there was one person which I met who was very professional. Her name was Aliyah Cheng. Unfortunately, I was not able to see her often. So I found out later that she was just on a contract basis and was not a regular feature there. So I lost track of Adelia until recently when I found out that she was not very far from where I live. And so I started going back to see Adelia, and I found that my hearing impairment improved tremendously with the hearing aid she recommended for me. And I'm very satisfied with that. Yes, of course, Soundlife was the one that actually helped me to improve my hearing. And I would really appreciate it. And I would recommend any of my friends who are looking for a good professional hearing aid consultant.
As we grow older, we often lose the extreme ends of our hearing spectrum. So, how many of the following sounds can you hear? How old are your ears? Okay, if you can hear 8,000 Hz, you're both alive and not hearing impaired. But let's keep raising the frequency. How high could you hear? If you could hear all of those frequencies, you're probably under 20 years old, but that won't last forever. Unlike other organs such as the liver or skin, the inner ear does not have the capacity to regenerate. In your ear, there are thousands of tiny nerve cells called hair cells. These are responsible for picking up different frequencies and sending the signal to the brain where it's processed. But as you age, the continual exposure to noise and loud sounds can break, bend, and destroy these cells. So why do the high frequencies go first? It turns out that the hairs tuned to high pitches are the first to encounter sound waves. As a result, they experience more stress and tend to degenerate earlier, which is why the older you are, the harder it is to hear high pitches. Got a burning question you want answered? Ask it in the comments or on Facebook and Twitter, and subscribe for more weekly science videos.
Do you always ask people to repeat themselves? Are you looking for new hearing aids but you are overwhelmed with all kinds of hearing information online? Or perhaps you already own a pair of hearing aids but it isn't quite working to your expectation. If you answer yes to the above questions, then you are a good candidate for our 7 days hearing aid home trial program. Hi everyone, my name is Aliyah Ching, Chief Audiologist and founder of Soundlife Hearing. In case you didn't know, Soundlife has been offering a 7 days hearing aid trial program since 2017, and up to date, we have helped more than 300 clients to choose their most comfortable and effective hearing aids to restore their hearing loss back to functional level. This 7 days hearing aid trial program is suitable for anyone who is interested to buy hearing aids but cannot decide which one to go for, or for those who don't know if hearing aids will be beneficial to them. First, you will need to make an appointment with our audiologist. We will start the session by asking you some questions to know about your concern, perform a diagnostic hearing test. If a disabling hearing loss is diagnosed, then we will proceed with the hearing aid trial consultation. Based on your hearing loss, listening needs, lifestyle, expectation, and budget, we will recommend a few models of hearing aids. During the 2-hour session, besides trying out the hearing aids on your ear, we will also do some simple speech tests and stimulate some challenging listening environment to see how you perform with those hearing aids. This will give you a better idea of which model is more suitable for you. After you choose the most suitable hearing aids, then you could bring the hearing aids home. Firstly, with this program, you are able to experience the hearing aids yourself. We are a multi-brand center that allows you to try out and compare a few models from a reputable brand such as Afiqah, Phonak, Resound, Rexton, Signia, etc. And you will decide which one best suits your needs. This way, we can help you to minimize the chances of you regretting on your purchase. Secondly, you get to try the hearing aids at home. It allows you to experience and know if they are beneficial in your own listening environment because each hearing aid fits differently for each individual. At home, you can try out the hearing aids when you talk to your family members, watch TV, and even listening to music to get a better idea on how it sounds like. Thirdly, you will be getting professional consultation by qualified and trained audiologists in Soundlife to answer all your inquiries and doubts about hearing loss and hearing aids. With the information provided, you will become more confident in using hearing aids. Fourthly, our audiologist is also available on WhatsApp during the trial period, and you will get constant support from us on any problem you face. We also offer a remote tuning session to adjust your hearing aids without you having to physically come to our center. Lastly, we also have a YouTube channels that contain a series of hearing aid tutorial videos to assist you in handling your hearing aids. If you have any further questions, please don't hesitate to contact us. And don't forget to subscribe to our YouTube channel if you haven't already. Thank you!
Okay, Assalamualaikum and hi everyone. Thank you so much for joining us today. So before we start, I'm just going to do a bit of introductions. My name is Afiqah, audiologist from Soundlife Hearing Base in Kota Kemuning. And
Hi.
also here.
Yeah, I'm Nadira, an audiologist from Soundlife Hearing PJ.
Okay, so I think we'll just share our slide for today. Okay, so this is going to be our topics. How does hearing affect mental health? Okay, so the reason we choose this topic is because October is actually both Audiologist Awareness Month and also a Mental Health Awareness Month. So I think it's quite a perfect time for us to discuss about how hearing and also mental health are actually connected. And we're also quite excited because we do have a special guest that will be joining us a bit later. So he will be sharing his personal story about hearing loss and also mental health. So here at Soundlife Hearing, we always say that taking care of your hearing means taking care of your mind. And when we can hear clearly, we feel more confident, stay connected, and will be able to live a happier life. So today, let us learn together how your ears and emotions are actually more connected than you might think. So now to start things off, I would like to invite Ain to share a bit more about what is actually the link between hearing loss and also mental health.
Alright, thank you, Afiqah. So this is such an important question. Why we need to talk about this mental health? Because many people don't realize that hearing loss doesn't just affect the ears or hearing. It also affects how we feel and interact with others. So when someone struggles to hear, they often have to put in extra effort to follow conversation, or this over time can lead to like frustration, stress, and even social withdrawal. So as you can see, when someone has hearing loss, their brain needs to work harder to fill in the missing sounds or words, and this extra listening effort can lead to mental fatigue or tiredness. So over time, that constant strain also can increase the stress, anxiety, and even depression. Okay, so this if this happens frequently, and it can also impact the self-esteem and emotional being of a person. And in fact, studies also shown a strong link between untreated hearing loss and also conditions like mental health issue, anxiety, or depression. So from the slide here, you can see 1 in 5 Malaysians experience some hearing difficulty, but most don't seek help. So they ignore the hearing loss, and this one doesn't just affect the sound that it also affects the life of the person and emotional well-being. So to stress on this, I would like to say even hearing loss is invisible, you cannot see, but the effects are not. Okay? So next, So I would say if we see it quite often, for example, some of our patients tell us that they feel mentally exhausted or like very drained or tired after just a few hours of social interactions. That listening fatigue, or also we call the brain is tired, because they feel isolated and they can't enjoy conversation like before lah. If they have normal hearing before. So if this happens more, it consumes mental load and also more brain work, right?
Mm. Yeah, wow. So it's not just about not hearing clearly, but the brain actually gets tired too. I think that is quite interesting, right?
Yeah,
And
the brain.
yep.
Mm,
And also, hearing loss can also affect people of all ages actually, starting from children to elderly, and the impact can actually look very different for each group.
yeah. So after, can you tell us or explain a little bit more how hearing affect mental health across different ages? Because hearing loss not only for elderly, as we know.
Sure. Okay, so if you can see this slide over here, so hearing loss across each group, I already divided into four categories for easy understanding. Okay, now let's start with children first. So children starting from newborn to 12 years old. When a child has a hearing loss, it can actually really affect on how they learn to speak, understand language, and also communicate with others. And if let's say this is not picked up early, they might really struggle in school or feel very frustrated when they cannot express themselves clearly. So sometimes this can lead to behavioral changes. What we may see as they seem a bit inattentive, avoid playtime, and sometimes they'll also lose confidence. That is why early detection is so important. When we support their hearing early, we are actually also helping them in terms of speech, learning, and also emotional growth. And for parents, it is very advised for you guys to actually refer to the child milestone guideline. You can get it online. Just use this as a reference and just to detect if, let's say, there is a red flag that needs further immediate attention. Okay. And next, second category is for teenagers. This is actually an age where fitting in really matters. Okay, they don't want to be different. They want to be like same as other peers. So actually, teenagers with hearing loss might feel a bit left out in conversation, or they might also feel very embarrassed to keep asking like, "Sorry, what did you say?" and ask others to repeat again and again. So over time, this can cause stress to them, low self-esteem, and sometimes even can trigger anxiety. And they might start pretending to hear, like act like they are normal and avoid social situations altogether. So if you do see that your teen seems quiet or a bit withdrawn lately, it's actually worth checking their hearing because it can make a big difference to their confidence and also social life. As for working adults, many adults actually experience hearing loss without actually realizing how much it is affecting them day to day. They often say, I can hear, but I cannot understand clearly. Often I see this kind of comments when I'm seeing patients in clinic. So when they are having meetings, phone calls, or at busy or crowded places, this can be really mentally draining to them. Like you are always trying to fill in the missing words like puzzles. So some might even start avoiding gatherings because it's just too tiring to keep up, and because most adults will wait about 5 to 7 years before seeking help, the emotional impact can really build up. Addressing hearing early not only improve communications, but it can also help to reduce stress and also fatigue. And for the last categories, for older adults, this is where hearing loss can really affect their emotional well-being. So you imagine when someone cannot follow family conversations or hear loved ones clearly, they may start to feel lonely or actually disconnected. So over the time, this isolation can lead to sadness, depression, or even memory decline or what we know as dementia. Okay, so that is why supporting hearing health is so important. It keeps them connected, confident, and also engaged in their daily life. So in the end, hearing loss isn't just about what we hear. It's actually about how we feel, how we connect, and also how we live. So it doesn't matter whether it's a child, teenager, adult, or even senior. Taking care of hearing means taking care of our relationship and also emotional well-being. Okay, and just going to share here an example of a milestone. Okay, so this is actually from one of our brochure available in Soundlife. If you do drop by in Soundlife, you can take one of this brochure. And do take note that there is actually two type of milestone. There is a development milestone and also a speech language milestone. So you just use this as a reference and do brings your children to to see professionals if you do see that some of them are not following the guidelines. It is advisable to do that. Okay. All right.
Alright. Thank you, Afiqah. That was such an eye-opening explanation. It also reminds us that hearing health and mental health are closely connected, and that everyone, no matter their age or uh, background, that they can also be affected in different ways. No? So, to give us a deeper and more personal understanding, we have a special guest joining us live today. So, hi, Mr. Tan. He's one of our patients who has kindly agreed to share his journey on how hearing loss affected his daily life and emotions and how he can overcome those challenges. So, let's welcome Mr. Tan to our session today. Thank you so much for being here with us. We appreciate that. So, for the first question, I'm sure that all the audience here are curious to know about yourself. Can you tell us a little bit about yourself and how you first noticed changes in your hearing? What were the first time that made you decide to get your hearing checked? Please welcome.
Um, Sorry, actually, the sound is not very clear based on just
Oh, I see. Can you do a bit of introduction about yourself, Mr. Tan?
okay, introduction of myself, right?
Yes.
Yes, yes.
Okay, my name is Jun Kai, and I am currently a school teacher. Okay, and I have been using this hearing app about 1 week. Yeah.
Mm-hmm.
And may
So,
I know how you first noticed changes in your hearing? Like when did you finally decide to get your hearing checked?
Again, your question?
May I know when you start to realize that you are having some issue with your hearing and you decide to come to Soundlife to do a hearing checkup?
I noticed my hearing loss during my university time. That time my classmate who sit two table beside me when she talked to me, I found that I very difficult to get what she talked about. Yeah.
Mm.
mm-hmm.
And also some people will describe hearing loss as like a feeling of disconnected. Do you also experience that?
Sorry.
The feeling, some people will describe hearing loss as a feeling of disconnected. Can you hear me?
No, I can't get your sentence. Sorry. Wait,
Or can I
not
get my
clearly.
sentence? Okay, not clear. Okay, so okay, I just repeat again. So some people will describe hearing loss as a feeling of disconnected. Did you get that?
Okay, I see the word. Some people they try hearing loss as feeling disconnected. Yeah, I have this feeling also.
Mm. And what kind of situation were the hardest, like during family gatherings, during your work or daily communication? How does it affect you?
Oh, okay. I think the most difficult time is when face to face. I think depend on the distance. For me, if the distance is one on one very near, there is no problem. But when the distance is some got quite distant then come to problem in any places, any situation. As long as the distance is not very near, I found that will be a problem. I can't get what other people talk. Yeah.
I see.
All right. So to tell about yourself, you mentioned that most of the time since your study, you mentioned you feel the difficulty to hear, you notice that, and then may I know why you only decide to come for hearing check now?
Did you get the question, Mr. Tan?
Uh, Sorry, can you
Uh,
repeat your question?
sure.
Yes,
Okay. So just now you mentioned you've been having this issue since university time, right?
Um, why decide for hearing check now?
Yes.
Uh, because my hearing affect my life already. I cannot get what people say will be a problem to my life, including
mm,
my work, my social life, uh, affected.
I
I
see.
see. All right. So okay, I think Vika, what Mr. Tan mentioned about feeling like affected his life or his sleep even before he noticed that, and after trying to listen for long periods is something that many people don't realize it's quite common, right?
Yes, that is correct. And actually, what Mr. Tan described is actually something we do call as listening fatigue. Okay. So listening fatigue is when someone has a hearing loss and the brain has to work much harder to make sense of sounds and to fill in the missing words. It's like trying to solve puzzle all day long, and that extra effort can be mentally exhausting. So when Mr. Tan mentioned the difficulty he's facing, when like distance can just now he mentioned distance.
Mm-hmm.
So that is actually a very real effect of listening fatigue. It's not just physical tiredness. It's also the brain's way of saying I've been working really hard to keep up. And the thing is, this can happen at any age. Teenagers trying to focus in class, adults in meetings, and also older adults trying to follow conversations at home. So over the time, this content strain can really affect concentration, mood, and even confidence. But the good news is, once hearing is properly managed through hearing aids, therapy, and also communication strategies, that fatigue usually improve. Okay, your brain doesn't have to work as hard, and people start to feel more relaxed and connected again.
Mm, that's so true.
Mm-mm.
Yeah, I agree with that. Many people with hearing difficulties like slowly withdraw from conversations, not because they want to, but because they get tired or like feel embarrassed from asking others to repeat. Lah. So this over time can also lead to social isolation and can really impact mental well-being. So here I just summarized three of uh, feeling how mental health are affected due to hearing loss. Lah. So firstly, it's frustration. Can you imagine, for example, in a restaurant with background noise, people with hearing loss sometimes will struggle more in noisy places, then they will keep on asking, what did you say? What did you say? Until like they give up or stop listening. So they become more frustrated. This is it is left untreated lah. And then for the second one is embarrassment. So imagine, for example, people with hearing loss that are working adult in a meeting, they misheard words or give the wrong response in a conversation or meeting, they will feel ashamed or worried about being judged by others. So they start to stay quiet or avoid speaking to prevent mistakes. So we don't wish that this keep on happening over the time. And lastly, the one we keep on repeating, hearing loss can actually make people isolated. So they withdraw from group chats, family gatherings, or social events. So during a conversation, imagine if, for example, we want to have a good conversation with other people, and then someone gets annoyed and they don't understand. They say, "Never mind, it's not important." So how that makes you feel? This can make the person with hearing loss people feel isolated or left out. So yes, over time, this social isolation can really affect mental well-being and also start feeling disconnected, not just from family, friends, but even from the world around them. They feel silent. So yes, there is research showing that adults with untreated hearing loss are twice likely to experience depression. So not only that, there's also one study here, up to 5 times people with severe hearing loss more likely to develop dementia compared to those with normal hearing. So to know more about this relationship of hearing loss and dementia, maybe you may refer to our previous live talk with our founder, Ms. Alia Cheng, on how hearing loss relates with dementia. Lah. Okay, so going back, I think we can ask Mr. Tan here.
Um,
Okay. How do you think about last experience of not so long wearing hearing aid for about 1 week just, but of course it's an initial step to improve your life lah. Okay. So I would like to ask Mr. Tan, okay, what made you finally decide to seek help or try hearing aid?
Okay. What made my final decision? Okay.
Mm,
It's because during my teaching classes, I can't get the long distance student about what they talk about. So it already affect my working lifestyle. So I need
mm-hmm,
help. I need my hearing help. So I
mm,
go search for uh hearing center. Okay.
mm-hmm,
Mm.
I see.
So it's mainly due to the my work already been affected.
Mm-hmm. Your work already affected.
Yeah.
So, how was your first experience wearing them? Was it easy or a bit challenging at first? How was the trial process of the hearing aid, and how was your first experience wearing the hearing aid?
Okay. First time I wear it, uh, I found that my hearing is improved, but there are also something uncomfortable
Mm-hmm,
situation that I need to uh what we call I need to accept like I am now I think the first one is I need to keep telling myself that now I am wearing a hearing aid and not a normal earpiece because
mm-hmm,
sometimes I will think like I'm wearing earpiece. Is it the sound is only I can hear or people around me also can hear? This is my first session. Okay. Yeah, I think basically it this. I need to keep in mind that I am wearing a hearing aid.
mm-hmm.
Yeah.
I see. So means when you wear the hearing aid now, you can hear something that you don't hear before wearing the hearing aid. So, do you think it's comfortable so far after wearing about 1 week?
Yes. Now it's comfortable. Uh, since I wear my hearing aid.
Mm. So, as all audience people know, as Mr. Tan already wearing for about 1 week, for Soundlife usually we will go through a regular follow-up for hearing aids. After 1 month treated with the hearing aid, the important or crucial step for every hearing aid user, which is the real ear measurement test. So this one will further customize the hearing aid setting and then will help people with hearing aids more to hear clarity. All right. So thank you for being so open to share how like your experience running the hearing aid and your effort to try out and understand different of wearing hearing aid and also normal hearing. So lastly, how do you feel now compared to before you use hearing aid? How do you feel?
Okay, first, my hearing is actually been improved by this hearing aid. And
Mm-hmm,
second one is that uh, I now I will be more confident. I will tell myself, okay, now I am after hearing wearing aid, after
mm-hmm,
wearing hearing aid, I will tell myself that now my hearing is like normal people. I do not need to like last time before hearing wearing aid that uh
mm-hmm,
I I mean is mentally that I okay the guy is quite distant far from me, so confirm I cannot get what the guy talk about. But now it's different. I am no more confident that even though the people is quite far from me, I also can get what they talk about. So I think basically not only improve my physical hearing problem,
mm-hmm.
also affect my mentally because I am more confident about I can
Mm-hmm.
get whatever people talk about. Yeah.
I see. So it's great to hear that you enjoy your classes more and more confident to teach your students, right?
Mm.
Mm. Okay, thank you. So we move on to the next one. That's very wonderful to share, sharing from a real life experience when hearing it. So this shows that how much life can change. Even for 1 week wearing hearing aid, hearing is also improved. But of course, we will need to go through all the process follow up. Lah. All right. So I would like to explain from audiologist perspective how audiologists support patients through this journey. So it's not only the patient task to go and do hearing check, it's also need audiologist support. Lah. Alright, so there is one patient once told me that I didn't realize how quiet my life had become until I heard the laughter again. This one is more like severe cases lah. So like almost the same as what Mr. Tan have experienced before. He didn't realize before wearing hearing aid he can hear more sounds. So this moment reminds us why early hearing care is so important. So it also affects a little bit in terms of memory of sound. So I would like to touch on again, hearing loss may be invisible, not everyone can see, but the effects are very real. So it affects not just how we hear, but not how we hear, but how we feel and connect with others. So that's why it's important to get your hearing checked as early as possible, not just when things get serious or when you can't hear at all then only too. So yeah, visiting an audiologist like us in Soundlife help you understand your current hearing status, even if you only notice small changes. So early start or early check is very important because hearing tests are not just for ears, they protect your mind too. There is also study here, even because nowadays in Malaysia, every female worker or male workers need to go through hearing check before entering their work, certain high risk exposure to noise. So this suggests that 63% of male workers had hearing loss compared to female workers. So these also suggest a potential link to occupational exposure in men. So monitoring of hearing and also um, the first hearing test you have done can be the baseline of how is your hearing progressing over the years. So with early screening, we can detect any changes sooner, and for us audiologists, we can give the right advice and help you maintain a healthy, active, and also happy life. So don't wait until it becomes severe. You can come to Soundlife for hearing check and know your hearing status today. Alright? So yeah, Afiqah, I would like to ask, I'm sure many people are curious what actually happens during a hearing test. Can you explain a little bit about the procedure?
Okay, of course. Thank you, Ryan. So, hearing test is actually I think it's quite a simple, comfortable, and completely painless test. But before I explain how the hearing test procedure, I would like to share a bit more about how family supports plays a role in this journey. Okay, so family supports really makes a huge difference for anyone experiencing a hearing loss. When family members are understanding and patient, speaking clearly, including their loved one in a conversation, and also help encourage them to seek help. It will help to create a safe and supportive environment. Sometimes it's actually the family who first notice the sign of hearing loss, like the TV being too loud or needing things to be repeated often. So their encouragement can be the reason someone finally decides to come in for a hearing check. Okay, so by having that emotional and moral support really helps the person to feel less alone and also help them to be more confident in taking the next step, which is getting their hearing tested. Okay, so now let me briefly explain on how a hearing test procedure is. So first, the audiologist will help to check your ear using an otoscope to make sure there is no blockage like earwax or ear infections. Then we will do a middle ear test just to check your middle ear part, is it okay or not. And also we will do the pure tone test. Okay, this is actually the hearing test where we will let you wear a headphone or insert phone and listen to a series of soft beeps and different pitches sound. So each time you hear a sound, you just need to press the button given, or you can also raise your hand. This will help us to measure the softest sound that you can detect. Once the test is done, we will explain your results in detail, what your hearing level means, and whether you need any treatment or monitoring. Or if, let's say, some cases maybe need to further refer to ENT doctor, ear, nose, and throat doctor, will also refer you to the doctor. If your result show that you would benefit from hearing aids, we'll then proceed with a hearing aid trial session. So during this trial session, we let you try different hearing aid brands that is available in Soundlife, and you can test the sound quality and also feel it in real life situation. So just like I said before, we have different models. You can try all the different models and then adjust the setting and also understand which one will suit you better according to your lifestyle and also hearing needs. Okay, and we will also help to guide you through how to wear, clean, and also maintain the device properly, so you feel more comfortable and also more confident in using it. And also in Soundlife, the best part is that we actually do offer a 7-day home hearing aid trial program. This means that you can bring the hearing aid home, use them in your daily routine, and experience the difference yourself without feeling rushed to make a decision. Once you are confirmed, then you can proceed with the order. Okay? So I think it's quite a great way to make sure that you can choose the best hearing aid that truly fits your hearing needs and comfort. Okay? And also here, actually for hearing device, here in Soundlife we carry these 4 brands: Phonak, Auticon, Rexton, and Resound. And each brand will have different type of hearing aid. We have the BTE type, RIC type, custom hearing aid types. There's a lot of type actually. And we also have cochlear implant, for those who are interested in cochlear implant. And just to explain further about hearing device, this hearing device has these features like direct Bluetooth streaming, where you can connect your hearing aids directly to your smartphones, TV, or laptop to enjoy calls, music, videos with crystal clear sound. And for those working adults, you can also use the hearing aid. It's like an earphone to help you in meetings, Zoom calls, and some models even support hands-free call and smart app control. So this will let you adjust volume or programs easily from your phone. So overall, it's not just about better hearing, it's about staying connected, comfortable, and also confident in every situation.
All right. That's such a meaningful brief explanation about hearing aid and how hearing aid don't just help us hear better, but also help us feel better too. Alright, so to move on, I'd like to ask Mr. Tan, we invite him to stage again. Alright, so Mr. Tan, may I know what would you say to others who suspect that they haven't hearing loss but are still hesitating to get hearing checked or like to get tested?
What? Okay, I will advise them to at least get the hearing test. This is very important.
Yeah, so hearing test is very important so they know the hearing level and any advice for family members or friends who want to support someone with hearing difficulty,
Any advice for
like anyone who still uh, they realize their family members having problems so they want to uh, ask and support them to come and check and do hearing test.
Okay, I will advise them to support the the person with hearing loss.
Hmm.
Mm. Uh, okay, to support their because I will advise them by the way of telling them that hearing is very important. It's not because I will tell them that hearing will also affect our brain, so it's super important. It's not about hearing only. It also affect our brain. This is this info also is me after do the hearing test at Soundlife, then only realize that hearing will affect our mental. So it's
Hmm.
very important. Cannot must take it serious. Okay.
Yeah, true.
Yeah.
Thank you for sharing and thank you for joining us today. I think
Mm.
we have come to our end of life. So here is our reference from the data just now present, and also we would like to thank everyone who joined us today, and of course our special guest today. If everyone have any questions, you can ask us. We will try to answer during this Q&A session. Thank you.
Thank you. Okay. Thank you.
Thank you.
Thank you so much,
Thank
Mr.
you.
Tan, for joining us
Goodbye.
today.